Well, whenever I was 4 years old, my parents got me my first dirt bike, and of course my dad was involved in the sport, and he just was a local expert, and they just wanted me to have fun. Whenever I was 17, I turned professional, and I raced for 7 years as a professional, but I assumed I'd race even longer, but injuries caught up with me, and I decided to call it quits.
Shoulder injuries in motorsports, especially in motorsports where you're not surrounded by a vehicle, are very common because the shoulder is in such a precarious position. You can go over the handlebars, you can get hit by another vehicle, you can get hit by another person coming off of a vehicle, and the shoulder is in prime position to be injured because it's the connection between yourself, the rider, and the vehicle. Broc, let's say that you go head over heels over the handlebars. The most common injuries that you get from outside in, you can tear your rotator cuff. Pretty rare in young, active, healthy guys like yourself, but in the older riders, it's certainly common. You'll have pain right out here, and it sometimes goes down the side of the arm right like this. You won't be able to lift your arm up over your head, not only from pain, but also because it'll be extremely weak. Most common things that happen here, the AC joint right here. That's where the collarbone connects to the shoulder blade, and it'll be separated. It's an AC separation or a shoulder separation, and you'll see the collarbone sticking up, and the shoulder will be drooped down. It's really common. You have pinpoint pain right there. It's miserable to bring your arm across your body or to hold your arm up on the handlebars. Usually prevents guys from riding anywhere from a couple weeks to a month or so. And then the final thing, something you're really familiar with, collarbone fractures. Pain anywhere from here to here. When you fall and you tuck and you land directly on that shoulder, that collarbone is the only part of the body that connects the sternum, the central part of your skeleton, to the arm. And so that tends to break. It's the most commonly broken bone in the body, especially if you ride motocross.
We have all the strength exercises down here at UPMC. They show you with all the bands. So a lot of people don't realize, even though nothing's broken, there's still an issue there with the muscles and the tendons, so you have to strengthen them before you come back.
Shoulder strengthening exercises such as focusing on the rotator cuff, as well as the muscles that cross the shoulder joint, the deltoid, the pectoralis muscles, and the back, the core muscles, can really be helpful, but not only to increase the athlete's endurance and the ability to perform throughout the exercise, but again to minimize the injury if you have a potential collision or get thrown from the vehicle.
Any injury I had, they were able to get me back on the bike as quick as I could.
At UPMC Center for Sports Medicine, we're particularly qualified to take care of athletes of all ages, all skill levels, all activity types. We have a large team of multidisciplinary physicians and physician support staff members that can take care of any injury, complex or mild, and treat the entire athlete to make sure that they can get back to the bike, get back to the quad, get back to the sport as soon as possible and as safely as possible.